Okay, love these ones, especially for musculoskeletal. Sheet cleft points. So I mentioned we use these obviously for acute conditions. Do most of you actively use the sheet cleft points? They're just so effective. Anyone coming in with chronic pain, now they treat acute disorder. So how would you define an acute disorder? What are the characteristics of something acute? Comes on quickly, would you say, Casey? Yeah, sudden onset. Good. Increase or varied severity, so it's intense, but it can sort of come and go. It can disappear as quickly as it sort of comes, varies in intensity. So that's that kind of thing where someone comes into your clinic and they're just sciatica or any kind of, they're just like, oh, gee, it's just really sore. You can tell they're physically in pain. There's so much stagnation there. That's when you need to use the sheet cleft point. That should be one of the first points you needle because that'll give them almost immediate, it'll immediately turn the volume down on that pain. And I'll tell you why. The sheet cleft points they're called sheet cleft points because obviously the word she means cleft. And it's said that this is why they're so effective at treating acute conditions. The classics say at the sheet cleft point, the chi gathers and becomes excessive, right? So if we've got, well, let's take a sheet cleft point, just say the large intestine. Sheet cleft point's large intestine 7 for the large intestine. So we've got, 4, 5, large intestine 6, and then a cleft suggests that every time we see the word cleft, it suggests there's a bigger opening. There's a deeper channel. So large intestine 4, 5, 6. Then when we get to large intestine 7, then 8, 9. See what happens there? That's the analogy of the sheet cleft point. The depression is a lot bigger, and this is why it's so good at treating acute conditions. At the sheet cleft points, the chi gathers and becomes more excessive, which means if chi's flowing through those meridians, through that meridian, it's going to fill up those points. See what happens when see what happens there when the chi fills up that sheet cleft point. It's more excessive. Therefore, there's more pressure, and especially on something like a Yang Ming channel. This is why they're so good at treating acute conditions, because when you needle that sheet cleft point, bang, it just releases this shot of chi through the channel and just gets rid of any kind of stagnation, or at least gives it a red hot go. So it's sort of opposite to what I was talking about with the Jing River points, isn't it? That's got that slow, dredging kind of action, whereas the sheet cleft point just bang. You need that really strong belt. So often I'll describe that to a patient. I'll say at this point, I'll say it's called the sheet cleft point. It's for acute conditions, but what I'll actually give them an analogy, I'll say it's like pressure cleaning a pipe. So if you take an old pipe, if a plumber takes an old pipe off your wall and it's got all this moss and crap and all like that kind of stuff, you can't just run a hose through it, can you? You need to put a high pressure water thing to just belt all that stagnation and all that stuff out of the way. So it's the same sort of thing. If there's chronic stagnation causing chronic pain, the sheet cleft point should really be one of the first points you consider for that channel.
So like a Jing River?
Well, it's slightly different to Jing River because Jing River's got sort of a more slow churning action. Sheet cleft point is just like bang. So they're almost like really good like first aid points, if you like. So it doesn't have to be for pain, right? You're walking with someone and then suddenly they just get an acute asthma attack. Boom, lung sick, sheet cleft point. Okay, so it gives a shot of chi through the channel to immediately regulate the channel as well. Now, having said it's for acute stuff, things like the sheet cleft point of the spleen is not as much used. I certainly don't use it as much, and the kidneys and things like that, because not a lot of acute stuff happens to kidneys, unless it's a kidney stone that's flared up. But these kind of like kidneys, spleen, it all happens over a more chronic kind of thing. It happens over a period of time. So the Jing River points for those meridians, to me, would be better, and the source points. But the sheet cleft points for those really volatile meridians, like, the liver, the large intestine, the stomach. So food poisoning, that's a sort of an acute condition of the stomach, isn't it? You sort of, you eat too much or you eat something that doesn't agree with you and you start getting these blinding stomach pains. Boom, sheet cleft point, which is what? Anyone know the sheet cleft point of the stomach? Stomach 34, good, yeah. Stomach 34. So that's one of, if you feel those kind of symptoms, come on, just jam your finger into stomach 34 and that's a Yang Ming channel. So there's a lot of pressure at that sheet cleft point ready to just be belted into that channel. So again, think of it like you're just pressure cleaning a pipe, the channel, getting rid of all that chronic stagnation that's there. severe sudden pain, sudden asthma attack. So any channel that the acute stuff's on, food poisoning, acute lower back pain, depending on what channel it's involved.